I would like to just introduce you a little bit to some people who are going to be watching this curriculum. And many people will know you as an addiction medicine specialist. You've been in this business a long time. And today I think you're going to tell us a little bit that you didn't just drift into this by accident. And I recall you telling me before that I think it was November 1984 was a really important time for you. Maybe you could just take it up and fill us in a little bit on that.
Okay. I'll never forget the day, actually. It was November of 1984. I was a small town family doctor. It was mid-afternoon, so I was about 8 patients behind. The waiting room was full. I reached the point of being so overwhelmed that I let myself out the back door, and as far as I was concerned, it was over. I wasn't coming back. I had come to the conclusion, I don't know how many months before, that it couldn't get any worse. I felt so terrible that if it did get any worse, I was going to end my life. And of course, I didn't share that with anybody. So it was out of desperation, but I really didn't know what the problem was when I left.
So compare for me what was going on in reality and the secret you were keeping, and what people would see on the outside, or indeed what your other 2 colleagues might have seen.
I think my colleagues were getting suspicious because they'd been to parties with me and they knew that I was the first one to leave, or that I was more likely to get carried away with my drinking. And I think they'd noticed that the drug counts were a bit out from time to time in the office. No, they hadn't confronted me at all. I don't think they knew what to do about it. I knew they liked me and were concerned about me, but I was living this Dr. Jekyll, Mr. Hyde, conscientious, compulsively up-to-date physician. I mean, remember, within 2 months of walking out of that office, hitting bottom, being at death's doorstep as far as being suicidal, I had come in the top 25 percentile in the Canadian College of Family Physicians certification exam. So I could still pull it together. But on the inside, I was dying, and I was filled with shame and frustration and fear and anger. It was just so confusing. But it wasn't obvious to me that this was addiction.
Not at the time?
No. I didn't know what addiction was. I thought I'd know what an addict looks like. It just didn't fall together like addiction to me. I don't know what I was looking for. It just didn't feel like addiction. I think I saw it as I was just doing that to cope.
Right. Now, you've been very successful, extraordinarily successful in your own career, and it is common that we would see people, high achievers, doing well, scoring well on exams, or is it more typical that we would see people at the lower end of the academic grade, or where did you fit in all that?
One of the problems with the Vancouver downtown east side is I think it takes our eye away from the real problem of addiction, because the obvious disenfranchised, low-bottom drunk or addict is that 5% tip of the iceberg. Most people with addictions don't look like that, and I think I do represent a very typical substance-dependent person. As a matter of fact, Paul, when we work together with employers, when we're educating employers to look for the employee who's starting to get into trouble with addictive disorders, that they're often your high achiever. They're often the one of the best. And so I, with this growing sense of my outsides and insides didn't match, I had this sense of shame. If you knew who I really was, you would not be saying those nice things about me. So it meant that I had this growing cognitive dissonance, this awful feeling of shame that just kept driving me. And by driving me, it made me achieve more and more and more.
So academically you achieved?
I won the undergraduate gold medal in honors physiology before medical school. In medical school, I was the class valedictorian. And I don't think that's atypical. I think that, so if you're looking for us, you'll often find us near the top until very, very late. If you're waiting until you see us disintegrate, to deteriorate with obvious psychosocial problems or work-related problems, It's late. There's been a lot of damage, perhaps central nervous system damage and psychosocial damage, to the point that coming back is very difficult. The mortality rate goes way up.